Courtland, Keteyian. Welcome to the show.
Thank you.
Nice to see you. Now, when you were back in the Ivy League for school, did you become a New England Patriots fan?
I like Tom Brady, right? like any good Michigan fan, right? I like Tom Brady, but no, I did not. I did not take on the Massachusetts or the Boston thing while I was out there. So, not my style.
Yeah, the true believers are born and raised.
They are. Yeah, they are.
So we were talking about before the show. We were talking about Super Bowl snacks,
Mm-hmm.
and that's not a day you have to worry about eating healthy, is it?
You get a cheat day every once in a while.
Yeah.
You know. Yeah. Everything in moderation is okay.
Did you? What did you do for the Super Bowl?
Well, I actually went to San Francisco on Saturday.
You were at the Super Bowl.
I wasn't at I actually did not go to the game. I was at an event before it. I got kind of lucky. I got invited at the end, kind of last minute, and so I went. It was really fun.
Awesome.
But then I came back on Sunday. I actually didn't even watch the game because I was traveling back.
Well, that must have been a neat experience because
it was pretty cool.
There was a lot of cool stories about how the San Francisco area was really dressed up for the game.
It's really neat to see how much a city will change and evolve to be ready for an event like that. I mean, it was years ago they did it in Detroit. That was Super Bowl 40. So that was 20 years ago. But they made Detroit look really nice for Super Bowl 40. So it is pretty cool to see how they change a town for those things.
Yeah, Detroit did a lot, like when they had the NFL draft and they had
super
some
cool.
Basketball tournament games. They put on a big...
Yeah, it's neat. It's really neat. So yeah, I was fortunate to get to go do that. So it's neat to have that experience.
That's neat.
Yeah.
So today we're seeing some improvement in the weather, warming up, and I think that's good news because a lot of what we're seeing in terms of illness during the winter is because we're all inside on top of one another.
Yeah. Yeah, you don't really catch cold, when you're outside in the cold. Like it's that we're all kind of confined.
Now there are moms that are watching that, of course, would...
they may disagree.
Yes.
Yeah, they may disagree. It's hard to get the kids to bundle up if you don't catch cold outside, but no, and we continue to have pretty significant. So, if you look at the top causes, we'll just say death in the United States, right? Easier to kind of track. Cardiovascular disease is number one, right? So heart, vascular. Cancer is number two, and then on the top 10 list, number 3 usually is like accidents. So that's like car accidents and other things like that. But if you combine, so to me, like pneumonia, flu, COVID are all like respiratory diseases. So if you kind of put those together, that would be number 3.
Really, all respiratory diseases, number 3?
The big ones, right? Yeah,
wow.
Flu, so pneumonia, flu, and COVID. So if you take those, and that's today, that's not during like the COVID pandemic, right? That's like today in 2026. The top 3 would be cardiovascular, cancer, and then flu, COVID. And what's interesting, flu, COVID, pneumonia, and what's interesting about all of those is, generally speaking, death from those things is very preventable, right? So there's actually a lot of control that we have over our long-term likelihood of getting cardiovascular disease, having cancer, or dying, having the most adverse outcomes from respiratory illnesses.
Right now, there is a lot of COVID in the nursing homes.
There is.
And it has been all winter.
Yep.
And you're seeing a lot of that in the hospital, too.
It's in the hospital. All 3 of those respiratory diseases. I think the most important message, I think, for people to be aware of, right, is I think we all figured we were like past the COVID pandemic. And generally speaking, the hundreds of thousands of deaths per year, like we are past that worst part of it. But what's really important is, like, when people start to get any type of respiratory symptoms in the winter, it's really important to get a test, right? And generally for flu and for COVID. And these things are available over the counter now, these little antigen tests. Super easy to do, they're not very expensive. Just to know if you have it or not. And the reason for that is they're treatable, right? So COVID, you can get Paxlovid, which is an oral medication, and you have to start it within 5 days. Which ideally you do it as soon as you can after getting symptoms. But you know, if you're somebody especially that's like higher risk, and high risk means you have like any chronic disease, even like high blood pressure is considered a chronic disease, being overweight, or you're just like over age 60, 65, like that significantly increases risk of a bad outcome with COVID. You should get treated. And same thing with flu. We have medication you can start with flu, Tamiflu. Usually it's in the first 48 hours. It's a little tighter, 48 hours, a little tighter window for flu. But it's just really important to like go get tested. You can go in somewhere, you can get the test at home, do it, and then if you're somebody it makes sense to treat, you can get an appointment and get treated and really prevent the bad outcomes. There's a lot of folks that end up still in the hospital, in the ER, in respiratory distress, right? Really, really kind of bad outcomes for things that we can mitigate either upstream with a vaccine or if you do get it, with a medication after the fact. So they can really be managed at home.
And you're seeing deaths among young people too?
Still, yeah. Yeah, we've had, I mean, there's been, I think the last numbers have been around 10 pediatric deaths in the country this year with influenza. So they definitely happen. I don't think we have any locally, but you know, that's not really important to say. Like it does happen in children, more common in adults. We absolutely have adult influenza deaths in Jackson, in this community.
And it gets bad like fast. So you emphasize, you know, getting tested so you can begin treatment if you don't get treated. And it does get to a point where you're hospitalized. The options are very limited on treatment.
It's just, yeah, when you end up in the hospital, it's supportive, right? You end up with, depending on how severe you are, right? I mean, people could end up on a ventilator, right? You're just supporting or giving people oxygen, supporting them until they get better on their own. The best thing to do is to get a vaccine upstream. Even if you still get sick, the probability of being hospitalized is reduced by more than 50%. It's very effective, both flu and COVID, and pneumonia, all three of those things you can get vaccinated against. The vaccines significantly reduce the risk of bad outcomes like hospitalization. And if you get it, flu, COVID, you can get treated with medication right away. And technically pneumonia too. If you have a bacterial pneumonia, we'll put you on antibiotics. So all of these things are treatable, right? So as soon as you know what it is, right, we can do something about it.
I think something pretty significant happened yesterday. The federal government has been very lukewarm in embracing vaccines for really anything. Yeah. But for the first time yesterday, the federal government, and I believe it actually was the HHS secretary that said, get the measles vaccine, which is RFK. And that, to me, that was the first time I ever heard really a full-throated endorsement for any vaccine.
I would love to be in the room with like Mehmet Oz and RFK Jr. talking about how they're going to reflect out to the public, you know, our recommendation on the vaccines, right? I mean, Dr. Oz is a physician, right? And so, like, he's very grounded in science, at least the things I've seen him speak at, or things he's written or talked about over the years, right? And then with, you know, obviously RFK has kind of been a lightning rod, but yeah, they did come out, both of them, very clear in support of the MMR vaccine, the measles vaccine, which that's the one, if you actually look back, that people have really, there was a study which has been discredited, which showed a relationship between autism and the MMR vaccine, which was a study done in the UK that's been totally discredited for the methodology of that study. And so to see them do that publicly is fantastic. And it's in response to a resurgence in cases. So there are pockets where there's been hundreds of cases in multiple states, South Carolina, Texas, and in California too. So we have somewhere around 3,000 to 4,000 cases of measles in the country kind of during the last, kind of like this season, right, over the last 6 months or so. And back in 2000, when we declared that we had eradicated measles in the United States, I mean, there would be cases here and there, right? But very small numbers, right? There'd be half a dozen cases here and there. So to have thousands of cases in the span of a season it's a huge backwards step from where we were just 20 years ago. So I was very, very pleased to see that, I guess, reversal, or that really clear messaging from the government.
So when it was nearly eradicated, and there really wasn't a fear anyone had of getting the measles because it just didn't exist, then did we kind of take our foot off the gas on vaccinations?
That's exactly what happened. Yeah. So measles is a two-dose vaccine schedule, and it's incredibly effective. One dose of measles vaccine is like 95% effective, and when you get the second dose, and these are all you get when you're a kid, takes you up to like 99%. So it lasts virtually your entire lifetime from those two doses. So it's super, super effective, and you get it out of the way when you're young. So it's an excellent vaccine, and we've seen what happens when you back off with vaccination, right? So we're getting these measles cases. There's pockets in the U.S. where we're seeing cases of polio again.
Oh my gosh.
Which is scary, right? Like, polio is an awful disease, and communities where we have low vaccination rates. So there's absolutely things are correlated between how vaccinated people are and prevalence of these diseases that we had basically gotten rid of 10, 15, 20, even 30 years ago.
Yeah, well, people my age and older, we all knew someone that had polio.
For sure.
Yeah. So
you knew they were on crutches or in a wheelchair, or they had some of the neurologic complications of polio. We don't see those things as much anymore, thankfully, but yeah, I mean, the risk is there if we don't stay on top of it from a public health perspective.
So we have full hospital. People are concerned about getting sick or getting someone else sick by actually physically going to a doctor. There's options. It's actually there've been some really great improvements in interfacing with healthcare providers virtually or remotely.
Yeah, so the first thing is, it's important for people to have a primary care doctor. It's so much easier to get what you need when you need it, when you're like emergently needing it, if you have a PCP. We actually have in the Jackson community, very high prevalence of people with primary care, but it's important to emphasize that because it's kind of your way into a lot of these other services. So like at Henry Ford, we have a program, My Care on Demand, so you can literally you log in through the app, right, for MyChart, and you can video visit, you can video chat right on there, you can schedule it. The wait times are generally pretty short. It's with local, either here locally or in Detroit, doctors here. But you got to have a primary care doctor to be able to do that. If you don't have a primary care doc, and actually that's also important. If I talked earlier about getting Tamiflu, if you have the flu, or getting Paxlovid, if you have COVID, you have to check medication interaction to really give those medications. Much easier if you have a primary care doctor that knows what medications you're taking than if you're trying to go into like an urgent care, or you have to go to the ER or something because you've gotten sick. So that's the first thing, is it's really a good idea to have a primary care doc. And that makes it easier to do the virtual care. If you don't have that, there's tons of urgent care walk-in type clinics that are in the area. So there's a lot of opportunities people have to get tested, to get treated without having to go to the ER, right? Which is where nobody wants to go spend an afternoon or an evening for a respiratory illness.
All right. Well, thanks for all the info and advice. Thanks for coming in today.
Thank you.
From Henry Ford, Jackson, Dr. Courtland Keteyian. Up next.